Thank you.
You're probably sleeping at the switch.
Let's face it, most of us in healthcare today have a siege mentality from new legislation like the ACA and provisions like the Sunshine Act. But these laws are merely symptoms of an underlying disease, a disease that in many ways is like a cancer that has metastasized throughout the globe. This one looks to blame. It looks to demonize and eliminate collaboration. Now, I was asked today to comment on the implications to industry from the Affordable Care Act, and to do it in less than 5 minutes. I appreciate the opportunity to speak about a topic that impacts all of us in this room, but most importantly, how it affects patients that you see and serve every day. Have no doubt there will be many intended and unintended consequences from these laws, but particularly so for patients. There are many ways that patient care is being harmed, but the one I want to focus on today is one of the stifling of innovation. Breakthroughs that happen, they seldom happen in a silo. Medical breakthroughs require ideas, requires insight, direction, and it usually comes from those of you in this room. Instrument is the industry. We are merely the instrument, a means to an ends of a collaborative product development process that can actually, in the end, touch the life of a patient. Now, history actually has a wonderful story about the power of collaboration, and it's so immediately so in the cardiovascular space that has changed the world. And the positive impact on patients has been remarkable. Now, know that the Sunshine Act is not just an obtuse reporting mechanism and exercise. It publicly ties the dollars that you and then that you have with companies, ties them to products. It reports it all as personal income, even if it's just reimbursement for travel or a cup of coffee or tea. The injury lawyers are simply licking their chops at this point. They will accuse you of accepting money while harming patients. And you have to remember that liability cases seldom seek the truth. Imposed this year, the medical device tax in the ACA has already led to many unintended consequences. Money spent on the new tax is money that cannot go to philanthropy, medical devices in the way of product development, clinical trials, CMEs, new plants, maybe most importantly, new jobs. We need balance. Nearly all of the great advances in medicine in the modern era has resulted from bridges between us in this room and patients. Our association with each other must be encouraged and even celebrated, instead of discouraged and demonized. No one is disputing that egregious actions have occurred. The recent DOJ settlements are living proof of that. But virtue, doing the right thing for the right reasons, is what the vast majority of us do on a daily basis. Today, we stand on the threshold of a time when nearly everything or anything is possible. Thanks to Frank Veith and others who put on this program, you've had 4 remarkable days of seeing just what is possible. Procedures and treatments that a few short years ago were unthinkable. Patients will get the most from this revolution if we're encouraged to work together. Now, one thing I've always wanted to say, thank you again for the chance to say it here today, and from some of the greatest minds in medicine, is that somehow, in all of the vigorous debates regarding health policy these last many years, something has been lost in the conversation. Lawmakers have lost sight of the vital role that you play. Those of us who work with you know of your dedication. Far from self-interest, time and time again, we are witness to the extraordinary selflessness, and deep commitment that you bring each and every day. So although you don't hear it from the podium very much, let me simply say thank you.